Welcome to the High River District Healthcare Foundation. My name is Jody, and we are so excited because we are celebrating our 40th anniversary as a charity and a foundation in the foothills. And as a part of that celebration, we want to have some conversations with local experts about different topics that will help you with your health, with your family, and with your community. And today, I'm so excited to have Helen Yoo joining us. Helen is with Recovery Alberta. How are you? Happy New Year, Helen.
Happy New Year. Thank you so much for inviting me to be here. I'm so happy to celebrate the foundation's 40th and be on the first Facebook Live conversation.
Yeah, and you're the first one. You're cracking open the year's worth of conversations. And what we really wanted to start with today is I'll give sort of an overview of where our conversation is going. And so today we're going to talk about Recovery Alberta. This is a new title that people may not be familiar with. So we're going to explain how that came to be. We're going to talk a little bit about a couple of cool programs that the foundation has funded with Recovery Alberta. And then we're going to give you some tips and ideas for mental wellness. We are deep in the middle of winter in Alberta, and we know that mental health becomes a big topic this time of year, as well as, 365 these tips will work for, but we know in the deep middle of winter, it can sometimes feel like a little bit of a bluer time. So we're going to have those conversations today too. But Helen, let's start with Recovery Alberta, because people will have known it as addiction and mental health, right? And so what sort of happened to be the behind the scenes change to what it's called now?
Yeah, so Alberta Health Services used to cover the addictions and mental health programming component of healthcare services. But over the last couple of years, Recovery Alberta was the first one to kind of break off from Alberta Health Services. But we're still dedicated more than ever to our communities and High River and Nanton, and serving those that are needing mental health support. It just feels like now there's a more focused effort on mental health and addiction programming. And we just as a clinic want to continue to focus on our partnerships, certainly in High River, our relationship with the foundation and neighboring agencies, which still means so much to us.
Awesome. So for people that need to access Recovery Alberta, does that process stay the same or has that changed with that change as well?
It's still stayed the same. So if you are wanting to get connected to programs in our High River Clinic, you can call Access Mental Health. I have the number pulled up here. It's 403-943-1500. You call, they'll do about a 40-ish minute assessment just to determine which program is the best fit. If they identify that you would benefit from coming to our clinic, they'd make the referral to us at that point.
So it's pretty much status quo. There's just
Yeah.
sort of some changes behind the scenes per se.
Yeah, that's exactly it. Yeah.
Yeah. Well, congrats on Recovery Alberta. And there are two programs that I wanted to highlight today that the foundation has been a part of funding. And we're excited again to partner with your group to help have these opportunities available in the community. And one is called the Day Program. Can you tell us a bit about that?
Yes, absolutely. The DAY program is a rehabilitative mental health group for clients that, for one reason or another, aren't a good fit for our talk therapy program. And this group focuses on building community relationships, life skills, and behavior activation. An essential component of this program is developing and working with the local organizations and businesses to support this individual. And thanks to the foundation's support, we've actually been able to serve over 20 individuals just since we started this partnership in spring of 2024.
That's amazing. It just continues to grow as the need comes up. And I think
Yeah,
that's really beneficial.
absolutely.
Have you noticed or been able to capture any of the impact that that has created in the community from this partnership?
Yeah, I mean, a lot of the individuals that have been a part of this group, um, some of them were experiencing some community isolation. And we've seen this beautiful, I guess, cycle of support where those that have been with the group maybe for, since the beginning or at least more than one round have stepped up as almost like a peer support role to support those that are maybe earlier on in their mental health journey. And that's been a really beautiful observation with this group.
Well, we hear so often the statistics behind isolation and how damaging that is, not only to your mental health, but also to physical health. So when people have that opportunity to sort of come together and form what I would call community within community, that's pretty amazing.
Yeah, that's exactly it. It's been really nice to have a part of our clinic.
Awesome. Okay, tell me about the neurodivergent training that is available for staff.
Yeah, so we completed it this past earlier in the winter. Neurodivergent in this case refers to individuals with ADHD, autism, sensory sensitivities, and some learning disabilities. Historically, those clients wanting specialized care or specialized therapy have been historically referred to the city for that specialized care. And we found in recent years that that's not possible or no longer accessible for our clients. And so this training allowed us to connect with an autism expert in the province. We did some therapy training, some consultations, and it's really allowed our staff to support this really vulnerable population that much better. And our staff is now more equipped to support this group of people. So, one of the programs that we have is our child and adolescent therapy program. So, we have a group of therapists and clinicians who are specialized in supporting child and adolescent clients. And actually, at present, we have about 75% of youth clients who have a confirmed or suspected diagnosis related to a neurodivergent presentation. Um, as one of their main reasons for seeking therapy. So, because of this training, we're able to support that number of clients just more effectively and in a better way.
I love this. And I think from a donor's perspective, it's very cool to know when I donate money into the foundation that it's going to not only beef up the programs that we have within our community and the staff who are already here, living here, working here, but then also into the community members who are in need of these types of services. It's like such a win-win-win scenario that is really beautiful to be a part of.
Yeah, absolutely. We feel the same way.
I think it's so cool. And I love that we just, again, get to continue to beef up what we're doing for healthcare nice and close to home. Any other projects you have on the go or things that you wanted to highlight today?
Actually, because of the neurodivergent training that you guys supported us with, I'm actually working right now. My big project is how can we continue that work and how can we continue that training? Can we get more supplies? And just tailor our entire environment to supporting that population better. So it's actually been a jumping point for us to further that work.
That's amazing.
Yeah.
Okay. Now, as we chatted off the top too, it's sort of the time of year where we're going to hear a lot about mental wellness, mental health. We hear about the sort of the phrase of Blue Monday. We hear about seasonal affective disorder. We know that winter and even the months where just there's not as much light, that people tend to feel a little bit more down. Maybe there's even elements of depression or anxiety that are coming to the surface for people. And so we're looking to share some of those tips, some of those ideas that people can support their mental wellness during this time of year.
I would actually say, given all of that, and with the timeline that the holidays have just passed, I would say one of the top tips or suggestions I would have right now to honor your mental health is actually starting small and being realistic with yourself. Focus on maybe just one or two achievable habits or tasks. It can be trying to create routine or structure in your daily activity. Maybe it's establishing a well balanced diet or working on creating a more regular sleep pattern. Another tip I have would be, just as we discussed earlier, Jody, is staying connected. As you said, research shows consistently that social connection is one of the leading factors which can impact your mental health for worse or for better. And so, whether it's with your friends, family, neighbor, or if you know that you need to reach out for some different support.
Yeah, I love that. And I love that you've brought up the starting slow. I think we're easily bombarded with the marketing of this time of year when it's like new year and new you, and you've got to change all the things and you've got to make all these resolutions. And I think in the past, we've really put a lot of pressure on ourselves to do all of this stuff in the month of January when we're already kind of feeling sluggish from the darkness. And there's so much pressure. And it's just a beautiful invitation to let the pressure off and knowing if there's something you want to add in, you have the whole year. You don't have to start it right this minute.
Yeah, that's exactly it.
Yeah, I love that. Were you a big resolution goal setter before you got into mental health work?
I've never been and I'm not now. I'm all about like little steps and little changes.
What are some of the favorite things that you personally like to do for your mental health?
I I actually love winter. I see it as
Yeah.
a time of like renewal for the upcoming year. Even when it's, minus 35 as we can get out here. And I have two little girls. So my husband and I, we often, bundle up the girls and ourselves, and we'll go spend, basically our whole weekend outside. So we'll do sledding or skating, and that's kind of what I really enjoy doing.
I love that. Well, I'm sure you've seen the amount of science behind the incredible effects of being in nature is for your mental health. And that can be as simple as you going for a walk, or if it's too cold or too icy to be out walking in the community, even just taking a few minutes outside with that fresh air is so beneficial to your mental
Absolutely.
health.
Yeah.
I love that. One of my favorites, I think I have to say, is that I'm a big fan of like meditation and yoga and finding ways to connect in with inner self. I'm also a big nature lover as well for mental health. But I've noticed a lot, there seems to be a lot of buzz around even just breath work and how um, tuning into how you're breathing and slowing your breathing is really good for calming that nervous system. Have you seen that in your work as well?
Yeah, absolutely. We have a mindfulness group, which I believe is a 9-week group that focuses on just that. And with our other psychoeducational groups, we have elements of mindfulness in all of them as well.
Yeah, I love that. Well, we know that when this conversation is posted on the foundation social media sites and YouTube, that there's also going to be a list of local mental health resources in the community. So just wanting to highlight for anybody that if you're feeling like, okay, I've done some of these mindful things, I've connected in it, but I'm still not feeling like I'm coming out of this down space. Knowing that one, you're not alone, and two, there's a lot of resource that people can connect into if they feel like maybe they need just a little bit more help with that.
That's wonderful. Absolutely.
Yeah. So lots of options for people in the community, lots of options online, lots of things. You can even, Helen, I'm sure you've probably even like Google had places where people Google like ideas for, feeling more uplifted. And there's lots of ways that people can use, ways of reading or connecting with, essential oils or all kinds of things, really.
Yeah, for sure. And I mean, if people are struggling to know which resource is the best fit for them, they're welcome to reach out to Access or connect with our clinic as well.
Oh, that's also nice to know because sometimes when you see the list, you're like, which one would I call? Where do I fit in this scenario?
Yeah, for sure.
Okay, I love that. Helen, anything else you want to share or add for our conversation today?
It's always wonderful connecting with you and the foundation, Jody. We're so fortunate to have this opportunity. Thank you so much.
Yeah, we love that. Thank you again for taking part in our mental wellness conversation today. As I mentioned, there will be some resources posted on our social media. You can also find out more at High River Health Foundation.ca. And Happy New Year, everyone.